Do you find yourself constantly restless, easily distracted, or struggling with organization? Could it be ADHD? Attention deficit hyperactivity disorder, commonly known as ADHD, is a brain disorder that affects a surprising 2.5% of adults. That's right, adults, not just children. It's a common misconception that ADHD is only a childhood disorder, but that's far from the truth. In adults, ADHD can manifest in various symptoms beyond the typical lack of focus. Restlessness, self-criticism, lack of motivation, and fatigue are just a few examples. It's not just about being easily distracted or hyperactive. The effects of adult ADHD can be far-reaching and complex, affecting every aspect of life from work to relationships. So, how do you know if you or someone you know might have adult ADHD? Let's delve deeper. Identifying ADHD in adults is a complex process. It's not just about being disorganized or easily distracted. It's a constellation of symptoms that persist for at least 6 months and significantly interfere with daily life. At the heart of adult ADHD are challenges that go beyond staying organized. These challenges often manifest in relationships where individuals may struggle with maintaining focus on their partner's needs or conversational threads. Forgetfulness is another common symptom. It's not just about misplacing the keys occasionally. It's about consistently forgetting important dates, commitments, and tasks, despite the best of intentions. Impulsiveness, too, is a key sign. This isn't just about making spontaneous plans or decisions, it's about acting without thinking of the consequences, which can lead to risky behaviors or regrettable decisions. Neglect of physical health is another concern. It's not just about skipping the gym now and then, it's about consistently neglecting healthful habits like regular exercise, balanced nutrition, and adequate sleep. And then there's the risk of substance misuse. This isn't about having a few too many drinks at a party. It's about a pattern of using substances to cope with the restlessness, anxiety, or other symptoms associated with ADHD. Indeed, these symptoms can greatly impact an individual's daily life. But how do professionals diagnose adult ADHD? Diagnosing adult ADHD isn't as simple as ticking off a checklist of symptoms. It's a process that requires a deep dive into your life, your habits, and your mental health. It's not just about whether you're forgetful or impulsive. It's about understanding the full scope of your experiences and how they align with the complex tapestry of ADHD symptoms. You see, ADHD doesn't exist in a vacuum. It often walks hand in hand with other conditions like autism spectrum disorder, depression, bipolar disorder, anxiety, and learning disabilities. This means that a thorough assessment by a mental health professional or physician is crucial. They'll conduct detailed interviews, exploring your personal history, your present circumstances, and your potential future challenges. They'll look for patterns, for overlaps, for symptoms that might have been overlooked or misinterpreted. Why is this so important? Because understanding the full picture of your mental health landscape is the key to managing ADHD. It's about more than just treating symptoms. It's about helping you navigate life with a brain that works differently. It's about acknowledging that ADHD can impact your psychological and physical well-being in ways you might not expect. And here's the thing. ADHD in adults is more common than you think, and recognizing it is the first step towards managing it. So if you're struggling, if you're feeling overwhelmed, if you're feeling like something's not quite right, it might just be time to reach out. Because understanding is the first step towards acceptance, and acceptance is the first step towards change. ADHD in adults is real, and it's more common than you think. We've journeyed through the complex labyrinth of adult ADHD together, unmasking it, understanding its symptoms, and learning about its diagnosis. The journey doesn't stop here though. Recognizing the signs in ourselves or others is merely the first step. Remember, ADHD isn't just about lack of focus. It can show itself in so many ways, from organizational difficulties and relationship challenges to restlessness and anxiety. It's a brain disorder that doesn't discriminate, touching the lives of both children and adults alike. But knowledge is power, and understanding these symptoms can be the key to unlocking a better future. If you or someone you know is experiencing these symptoms, it's crucial to seek professional help. Diagnosis isn't just about labeling, it's about understanding how to manage and live a fulfilling life with ADHD. Thank you for joining us on this exploration of adult ADHD. Remember, understanding is the first step to managing it. If you found this video helpful, don't forget to like the video and subscribe to our channel for more insightful content.